Why is your patient getting levothyroxine? Because my patient has hypothyroidism. What's the most common cause of hypothyroidism? It's called Hashimoto's thyroiditis, which is an autoimmune attack on the thyroid gland. Awesome job. What patient monitoring do we need to perform? We definitely need to check the patient's heart rate and blood pressure to assess for signs of levothyroxine toxicity, which would mimic hyperthyroidism. Okay, good. If the patient were exhibiting signs of levothyroxine toxicity, what would we expect their heart rate and blood pressure to look like? The patient's heart rate and blood pressure would both be elevated. Great job. Are there any other signs of toxicity we need to monitor for? Well, we need to make sure that the patient's not having any chest pain and that their ECG is normal, especially because our patient has a history of coronary artery disease. And why are we giving this medication so early? Well, we're supposed to give levothyroxine early in the morning on an empty stomach, at least 30 minutes to an hour prior to the patient's first meal. Why is that? Giving it on an empty stomach helps maximize absorption of levothyroxine. Excellent. Is there anything we need to teach our patient about taking their medication correctly? We definitely need to teach them to take it at the same time each morning on an empty stomach. And we should also teach them to avoid taking antacids or iron supplements at the same time as levothyroxine.